The integrity of which muscle is assessed by the Trendelenburg test. A. Sartorius, B. Varicose primaris, C. Gluteus medius, D. Semimembranosus, E. Piriformis. And the answer is C. Gluteus medius. Explanation is as illustrated. Regarding Trendelenburg sign, thank you. The Cori cycle is important in lactate metabolism in the septic surgical patient. It is used to describe a pathway in which glucose is metabolized anaerobically to lactate in one tissue and the lactate is converted back to glucose in another. Which of the following relies on this cycle to meet all of its energy needs? A. Erythrocyte, B. Hepatocyte, C. Leukocyte, D. Osteocyte, E. Pneumocyte. And the answer is B. Hepatocyte. Regarding the Cori cycle and alanine cycle as described. And next regarding the alanine cycle. Thank you. The Cotton test evaluate which of the following structures? 1. Calcaneofibular ligament, 2. Lateral ulnar collateral ligament of the elbow, 3. Ligamentum flavum, 4. Deep deltoid ligament, and 5. Ankle syndesmosis. And the answer is ankle syndesmosis. What is Cotton test? It is a manual stress test used to identify the amount of lateral translation of the talus within the ankle motis. The examiner stabilizes the proximal ankle while shifting the talus laterally. A positive test is marked by increased motion relative to the uninvolved side and is indicative of a sprain of the distal tibiofibular syndesmosis or the subtalar joint. A syndesmosis is defined as a fibrous joint in which two adjacent bones are linked by a strong membrane or ligaments. This definition also applies for the distal tibiofibular syndesmosis, which is a syndesmotic joint formed by two bones and four ligaments. The two bones are the distal tibia and fibula. The four ligaments are 1. The anterior inferior tibiofibular ligament, AITFL. Number 2. The posterior inferior tibiofibular ligament, PITFL. Number 3. The transverse tibiofibular ligament, TTFL. And number 4. The interosseous membrane, IOM. This picture or figure shows the syndesmosis joint anatomy. Okay. Ankle inferior tibiofibular ligament, AITFL, and posterior inferior tibiofibular ligament, PITFL, are the primary stabilizer of the ankle syndesmosis, limiting the motion of the distal fibula secondary to external rotation and 2 mm of displacement relative to the tibia during the physiological range of movement. Interosseous membrane, IOM, apart from stabilizing the syndesmosis, IOM also serves to transfer some of the axial compressive force from the tibia to the fibula during the weight-bearing activities. Widening of the ankle motis by 1 mm reduced the contact area of the tibiotalar joint by 42%. This would lead to instability and early osteoarthritis of the tibiotalar joint. Disruption of the intraosseous membrane IOM can increase the axial compressive force within the tibia up to 15%.
Regarding crush syndrome, A. Severity does not depend on the entrapment time. B. Crush injury to the hand is likely to progress to crush syndrome. C. It is likely to occur if there is compression to the limb of more than 30 minutes. D. Alkaline diuresis is usually given early to patient. And E. The patient is at risk of developing cardiac arrhythmias. And the answer is A false, B true, C true, D true, and E is true. Crush injury is defined as a compression of the extremities causing muscular and neurological disturbance and in the upper limb is sustained when the fingers, hand, or wrist are caught between two surfaces, either sharp, blunt, smooth, or irregular, forcibly producing damage to the skin and its enclosed contents of soft tissues and bones. The degree of damage is proportional to the amount of force applied per square inch and the duration of the compression is in place. Prolonged compression in heavy machinery in a more proximal part of the limb may induce a crush syndrome. The systemic effects of myoglobinuria leading to acute renal failure and sometimes can cause a cardiac arrhythmias. Alkalinization of urine is a method to prevent acute renal failure and subsequent deterioration. Michelson defined a continuous prolonged exposure on the limb of at least 4 hours duration prior to extraction is causing a crush syndrome. Crush injury to the hand distal to the wrist have less systemic manifestation primarily due to a smaller muscle bulk. Pathomechanics of the crush injury. The zone of injury sustained is a function of the applied force, the velocity, and the width of the offending object. The duration of compression as well as compounding factors, example friction, heat, cold, chemicals, and contamination add further damage to the injured area.
Which of the following statements regarding spinal cord injury are true? A. In trauma, the most commonly affected segment is the cervical spine. B. Spinal cord injury patient can be evaluated using the ASIA scale, which is sensitive outcome scale based on imaging. C. In Brown-Sequard syndrome, patient experience sensory loss of acute light distribution due to disruption of the both spinothalamic tract. D. Neurogenic shock is associated with spinal cord injury due to interruption of the sympathetic innervation to the extremities. E. Spinal shock is characterized by hypotension and bradycardia. And the answer is as highlighted and the reason for it. Thoracolumbar junction is more common due to transition between a rigid or stiff thoracic spine to less rigid or mobile lumbar spine. ASIA scale is a universal classification tool for spinal cord injuries based on a standardized sensory and motor assessment. Brown-Sequard syndrome is a neurologic syndrome resulting from hemisection of the spinal cord. It manifests with weakness or paralysis and proprioceptive deficits on the side of the body ipsilateral to the lesion and loss of pain and temperature sensation on the contralateral side. It is an incomplete spinal cord injury. Spinothalamic tract that are responsible for pain, temperature, and crude touch would be affected contralateral to the lesion because they ascend a level up and then cross to the opposite side of the cord. Neurogenic shock is a combination of both primary and secondary injuries that lead to loss of sympathetic tone and thus unopposed parasympathetic response driven by the vagus nerve. Spinal shock is defined as temporary loss of spinal cord function and reflex activity below the level of a spinal cord injury. It is characterized by flaccid, areflexic paralysis, bradycardia, and hypotension due to loss of sympathetic tone and absent bulbocavernosus reflex.